In your health news this morning, if you've got the cinnamon out for your oatmeal, listen to this. New research shows cinnamon could have adverse interactions with some prescription medications. A new study is warning against overconsumption of substances containing cinnamon because it could affect the metabolism of prescription drugs. They said more research is needed to look into specific interactions, but you should consult your doctor if you're looking at taking a cinnamon as a dietary supplement. The researchers added sprinkling cinnamon for typical culinary uses is unlikely to cause problems. Good news there. And influenza-related deaths for U.S. children hitting a high that we haven't seen in a decade and a half, according to the CDC. At least 216 fatal cases were reported this past flu season. That is the most pediatric deaths since the 2009-2010 season. Some health officials say misinformation about vaccines is a key driving factor. It's recommended everybody over 6 months old gets a flu shot every season. And the CDC says car accidents account for nearly half of all deaths in teens. A new study suggests the age of the car the teen is driving makes a big difference. Mandy Gaither has those details.
It's never easy allowing a new driver to take the wheel. Experts say teens face a higher risk of crashes due to lack of experience, immaturity, and their tendency to take risks.
Particularly when teens start driving unsupervised.
Ginger Young is an author of a study published in JAMA Network Open, which suggests another risk factor. She says the older the car that people drive, the higher the risk of dying in an accident. The study says driving vehicles 6 to 15 years old had a 19% greater risk of fatal crashes, and vehicles older than 15 years had a 31% greater risk, both compared to those driving vehicles 5 years old or newer, regardless of the driver's age. But Young says many parents pass down an old vehicle to their new driver.
Teen drivers that is 15 to 18 years old will more likely than middle-aged drivers that is 31 to 55 years old to drive a vehicle that is older than 15 years.
Young says the newer vehicles and driver assistance technologies can not only reduce crashes, but also their severity. And since parents often control what car their teen drives, she says teens should drive the safest vehicle available. If a newer model isn't in the budget, get frequent maintenance to ensure the car is running properly. When possible, seek out a car with driver assistance technologies and help them develop safe driving habits by educating teens on the dangers of risky driving.